medics and health.
County First Ladies ended their tour yesterday across 8 counties where they've been assisting the already set structures by counties' own cancer management and care of the cancer victims, with a call to have increased resources for cancer awareness about the onset and treatment. County First Ladies Association had earlier identified 8 counties with the aim of carrying out a pilot project that will address the high prevalence of cancer, which is currently accounting to an estimated 7% annual mortality rate in the country.
My name is Priscilla Muronge from Meru County. I'm the First Lady Meru County. In Meru, we already have quite a number of investigative machines. We're able to investigate. We also have a cancer center, which we are able to give treatment, chemotherapy. And the main problem we've been having previously was that we didn't have an oncologist. We are happy to report that last week when we were in Meru with the county First Ladies, we were able to meet the oncologist, so at least people are able to be treated in Meru Hospital. Meru is one of the counties where cancer is very, very prevalent. And before they all had to come to Kenyatta Hospital, some of them would get appointments for very long periods, and before even the appointment reaches, maybe they would not even make it. And so we are happy, we are able to do chemo in Meru. We don't have adequate space yet, it's quite squeezed, but the little we are able to do, we are very happy. At the same time, we don't have like radiation therapy there, so anybody who requires radio still has to be referred to the Kenyatta Hospital. In Meru, we are also coming up with a cancer institute because we realize that the approach of just doing the diagnosis or cancer screening is not enough. We want to go further and ask questions as to why, what can be done to prevent cancer. And this cancer institute, we hope, is going to be able to address those issues. We are going to have a mountain race starting from 4th of February, and that mountain race is going to be dedicated, all the crossings will be dedicated to dealing with cancer, because we realize that to create awareness, we need several approaches. And so it is going to be the first international mountain race, I think, in Africa. And we believe that's going to go a long way in even promoting the Cancer Institute. Otherwise, we are doing the best that we can. We are continuing with the screening, early detection. And I would want to say that right now, a lot of people are being assisted. We also have a hospice, which is very, very active. We even invested the hospice when we were there with the county First Ladies. And they are doing a lot because we realize not all cancer is treatable. So for those patients who have reached a point where they only need some tender loving care, they have an institution that takes care of them. And also, the palliative care doesn't just take care of those who are on their final stages. They actually take care of anybody who has been detected with cancer at whatever stage. So we are here to look at the gaps. Of course, there are very many gaps, a lot of needs. Cancer treatment, as you know, is very expensive, even for the counties. And we are hoping that through these partnerships, we can be able to come up with methods of creating awareness, seeing whether we can even provide more medication for our people, because it's not enough to just do screening and then what, you know? Where do you send people after that? So we are here to address that issue. Screening, then what? And can we also be able to address the issues? What is it that is causing so much cancer? What is it that has changed in Kenya all of a sudden? So I think that's why we are here, and we are happy that moving forward, we are going to see what solutions. We cannot get 100% solution, but we will try the little that we can do with the help of our support system. Today we've had a lengthy chat with the Governor, Makueni. Makueni is one of our model counties, and I think he has given us a lot of ideas on what we can do moving forward. And we are hoping that we can get all the county governors, starting with the 8 counties, with the deputy governors and us county First Ladies, to come together and create a strong voice for cancer. Hopefully, we can have it given more attention at the national government level. Thank you very much. Actually, that's one of the discussions we were having with His Excellency the Governor. that if we give it allowed enough attention, it can be addressed as a national disaster. Like you remember, HIV was a very big scare in the past. It was one of the diseases that people really were so scared to get. But today, because of being handled as a national disaster, it has been put under control. I don't want to say. We believe also with the county, with the cancer, if the counties and the national government took it up, because health is a devolved function. So we believe if it's made a national disaster, it will create more awareness and people will stop hiding. A lot of people nowadays get certain types of cancer like cervical. No one wants to talk about it, even to their own families. I know quite a number of my friends who are already suffering with prostate cancer. Their own family, immediate family, don't even know. Others with the cervical cancer, they hide because they are so ashamed to share that information even with their own children. That means that even their family is not able to take care of them because they don't even know what is ailing them. So we believe if it's declared a national disaster, it can be possible to remove the stigma so that people stop whispering behind your back once you've been diagnosed with cancer.
The association's chairperson Nazi Kibwana, First Lady Makueni County, said that failure to have early detection of cancer, lack of top oncologists and advanced radiation services have thrown majority of Kenyans into agony due to high cost of cancer treatment at later stages.
A journey to advocate on prevention, early detection and treatment of cancer. And we are here today to conclude the journey of fact-finding, needs assessment, which we have done. The county government has been very gracious and very generous to us. They welcomed us since June 21st, and we feel very, very happy that they have embraced us. They have promised that they are working with us. So also the other 7 counties, they did promise that they would be working with us in this journey of trying to eradicate cancer in our country. And it is actually a journey for every Kenyan. It's not just a journey for the county first ladies. With the governor of Makueni, there were callings that he should also be part of this. All the 8 governors should be part of this so that we can even amplify this advocacy even further. So we are here to do our report after the experience of from the 8 counties. We want to know what are the gaps, what are the challenges, what are the achievements, because indeed there are achievements already. There are some counties which are way ahead. They have started cancers. They have started centers for cancer like Kakamega, Nakuru, Kisumu, and even Meru. And there are others like Makueni, Taita Taveta, and Bungoma, which have not as yet started the cancer centers. And we are here to deliberate on what we need to put where so that we can help our people in the country.
Priscilla Paranya from Kakamega County. I'm the First Lady. And in Kakamega County, we have a cancer center which was opened last year. We have a total of over 6,000 patients. We give chemotherapy, and we are hoping to have more equipment so that we can do most of the investigations. As a First Lady, what I do is advocacy, and we carry out sensitization. We want to create awareness so that if they are detected early, at least cancer can be managed. And we also want to work on stigma, because once one is diagnosed with the cancer, there is stigmatization from the community. We want to create awareness through health work volunteers, so that the mashinani people and they can reach our people. And through advocacy, I think we will create awareness, and therefore people will accept to be checked early, and if we detected early, then they are put on treatment. We also do patient navigation. We are sponsored by AMPATS from MTR Eldoret. We hope to We are building a referral hospital in Kakamega County. We hope to create a big unit for cancer, a big center for cancer treatment. We also have a small hospice.
My name is Stella Samboja, First Lady Taita Taveta County. We want to begin with capacity building for the nurses, CHVs, so that once we start doing them, we have been doing the screening. So this time we want to get more in the mashinani, such that the CHVs and the nurses can be able to even detect early. And we also hope to have more oncologists on site and pathologists and the surgeons, so that when we start doing the treatment, we'll have started somewhere.
I'm Dorothy Nyongo, and I'm Mama Kisumu. In Kisumu, cancer is quite a serious issue, especially cervical cancer, because it's related to HIV. And so there's a cancer center in Kisumu, and they do radiation. They also have a hospice where they provide palliative care. The governor is determined to build a radiation center, so that is underway. This plan that is already underway. It takes a while, and it's a very costly affair, but in Kisumu we are hoping that we'll have a comprehensive cancer center before very long.
Reporting for the Kenya Digital News, my name is John Matava.